welcome students. Thank you for joining us this week. We'll start around 7:05 or a little before that. And thank you for those who turn on their camera. Okay, let's get started. So, hello everyone. Welcome to week number 6. We're almost over halfway there. Yeah, we just have until like week 10, and then after that, we'll just have an assessment days, and that will be it. So, um, thank you for joining us on a Sunday or your Sunday. And yeah, so this week's topic is headache, dizziness, and syncope. And yes, so feel free to have your vocab list out as Denny and I lecture. And yeah, feel free to stop us anytime if you have any questions, and we'll try to speak slowly. And yeah, we can start.
All right. All right, so first we're going to be starting off with some common conditions. So first we have migraine and migraine. So a migraine is a severe headache that usually recurs as in it comes and goes with some neurological features. Common signs of it is like it feels like a throbbing pain on one side, causes nausea and vomiting, and also photophobia, which is sensitivity to light, phonophobia, which is sensitivity to sound, and then dizziness. Tension headache. Tension headache is a headache from muscle tension. It feels like a band-like pressure and usually is tight around your neck to your shoulders. Ranges from moderate to mild pain, and it worsens with stress, and also scalp tenderness. Cluster headache. Cluster headache is severe cylindrical headache near usually one eye. So usually one pain on one side, tearing eye, feels like your nasal or your nose is getting blocked or congested. Eyelid drooping and then restlessness are some of the common symptoms. Vertigo. Vertigo feels like a false spinning sensation, like dizziness. So usually when patients have this, they feel like the room is spinning, they feel nausea, often vomiting, or they feel like imbalance or hard for them to balance. And it worsens whenever they move their head. Pre-syncope. Pre-syncope is the feeling of like near fainting. So with this, you feel lightheadedness, blurry vision, sweating, weakness, and tunnel vision. And syncope is the full thing of temporary loss of consciousness. So this is sudden fainting, brief loss of consciousness, but usually they recover fast. And usually when they faint, there's like possible jerking movements. Orthostatic hypotension. Orthostatic hypotension is a drop in blood pressure when the patient is standing. So whenever they're standing, they usually feel dizziness, blurry vision, weakness, fainting, or fatigue. Concussion. Concussion is a mild traumatic brain injury. So some symptoms of this is headache, confusion, memory loss, dizziness, nausea, and sensitivity to light. The next up is meningeal irritation. Irritation. So this is an irritation of the brain lining, and with this comes severe headache, neck stiffness, photophobia or sensitivity to light, fever, and nausea. This has really similar side effects or common symptoms as meningitis from a week ago. So yeah, so now I'll pass it off to Keach.
Yes. Okay. So for the second set of terms and conditions, we have benign paroxysmal positional vertigo. So short is BPPV, and it's an inner ear disorder causing positional vertigo. And common signs and symptoms include brief spinning episodes triggered by like head movement, nausea, and imbalance. And then next, we have vestibular neuritis. Vestibular neuritis is an inflammation of the vestibular nerve. So when you speak of vestibular, it's like a balance and balance system like locating in your inner ear. Yeah. And then signs and symptoms include sudden severe vertigo, nausea, vomiting, and difficulty walking. Now we have labyrinthitis. Labyrinthitis, which is an inner ear inflammation affecting your hearing. And common signs and symptoms include vertigo, hearing loss, tinnitus, and nausea. Next, we have Meniere's disease. Meniere's disease, which is an inner ear fluid disorder. So, inner ear fluid disorder. And some common signs and symptoms include episodic vertigo, ring in your ears, hearing loss, and you feel like a ear fullness sensation. Next, we have dehydration related dizziness. Dehydration related dizziness, which is dizziness from like low fluids. So we have dry mouth, fatigue, low urine, dizziness, and tachycardia. So high heart, very high heart rate. And then next we have hypoglycemia. Hypoglycemia, this is a very common condition, and it just basically means when you have low blood sugar. And major signs and symptoms is sweating, shaking, confusion, dizziness, and you're like easily irritable. And I think this is one of the main condition you should try to familiarize with, as well to practice with that later too. So hypoglycemia. And next we have anemia-related syncope. Anemia-related syncope, which is fainting from low red blood count. Um, and then we have fatigue, pale skin, shortness of breath, and dizziness. Um, and then we have cardiac syncope. Cardiac syncope. So when you see the word cardiac, it's probably do something with the heart. So it's fainting from heart tissue, heart issue. And then signs and symptoms include sudden collapse, palpitations, um, chest pains, and there are like no warning signs. And then next we have vasovagal. It's vasovagal syncope, and it's a reflex faint from stress or pain. So this is specifically due to stress and pain. And signs and symptoms include nausea, sweating, warmth, tunnel vision before fainting. And then we have post-concussive syndrome, which is persistent symptoms after concussion. So after your concussion, these symptoms last for a long time, so persistent. And then these are called, some of these include headache, dizziness, poor concentration, and irritability. And then we have intracranial hemorrhage. Intracranial hemorrhage, which means bleeding in the brain. And signs and symptoms include sudden severe headache, vomiting, neural deficits, and loss of consciousness. And then lastly, we have cerebellar stroke. Cerebellar stroke, and it means a stroke affecting the balance center, and we will often see severe vertigo, inability to walk, ataxia, and vomiting.
Okay, continuing with our conditions, we have subarachnoid hemorrhage. Subarachnoid hemorrhage, which is a bleeding in the space around your brain. So one of the most common symptoms is a sudden thunderclap headache. So a thunderclap headache is usually a severe sudden onset headache that usually reaches its peak in terms of like intensity or pain around like 60 seconds. It feels like most patients describe it as like a very intense, like worst pain of their life type sensation. And other symptoms are neck stiffness, vomiting, loss of consciousness, and sensitivity to light or photophobia. Next is tumor, which is an abnormal growth or mass in the brain. And common signs and symptoms are a progressive headache, which is usually worse in the morning, vomiting, changes in vision, and seizure. Next, we have posterior orthostatic tachycardia syndrome, or POTS for short. And this is an abnormal heart rate increase when standing. So common symptoms of this is dizziness, palpitations, fatigue, and the feeling of brain fog. Heat syncope. Heat syncope is fainting due to heat exposure, and with this, patients usually feel dizziness, sweating, weakness, and most notably like fainting in hot or warmer environments. Medication-induced dizziness is dizziness caused by medications, and they usually feel lightheadedness, imbalance, sedation, and confusion. Panic attacks. Panic attacks are sudden episodes of intense anxiety. So usually what comes to this is dizziness, a feeling of like chest tightness, rapid breathing, fear, and sweating. Next, we have transient ischemic attack. Transient ischemic attack, or TIA, which is a temporary loss of brain blood flow. And what comes to this is sudden dizziness, weakness, slurred speeches, and what's unique to this is that it resolves quickly, is a temporary loss of brain blood flow. And on the other hand is ischemic stroke, which is blocked blood flow to the brain. And also symptoms are sudden headache, weakness, facial droop, and speech difficulty. So this is very similar symptoms to TIA, but the main difference is that TIA is like a temporary loss, so the symptoms usually resolve themselves, whereas in a ischemic stroke, it's usually more long term. Is more likely to cause like permanent damage. A hypertensive emergency is severe high blood pressure with organ damage, and this usually comes with severe headache, vision changes, confusion, and dizziness. Arrhythmia-related syncope. Arrhythmia-related syncope is fainting from abnormal heart rhythms, and usually this comes with palpitations, sudden syncope, and dizziness. Toxic ingestion. Toxic ingestions is exposure to harmful substances, whether it's for like consumption or inhalation. And this usually causes patient to feel confusion, dizziness, vomiting, and an altered mental status. A seizure disorder is an abnormal brain electrical activity that causes reoccurring seizures. So patients will usually experience a loss of consciousness, jerking movements, and a feeling of confusion afterwards.
So now we have some procedures. So one of the common ones is a CT head scan. You probably heard of this one. It detects bleeding, tumors, and trauma in your brain. And a pro is that it's very fast. You can get it done in minutes. It's widely available in the ER. And then it's an excellent test for like procedure for like acute bleeding. And then the con is that you will get exposed to radiation. It's less detailed for soft tissue, and it may like miss early stroke. And then we have MRI. So we probably heard of this one too. MRI brain scan. It's a detailed brain imaging. And a pro is that there's no radiation involved, unlike the CT scan. It's highly sensitive for tumors, stroke, and it's better for soft tissue details. And then a con is that it's expensive, it's a bit slower. It's not always available in the ER, like emergency rooms, and it cannot use with like if you have some implants in your body already. And then next, this one's a hard one. We have electroencephalogram, or you can call it EEG, and it measures brain activity. A pro is that it detects seizures and it's non-invasive. So you've probably seen it. They just have like um, it's like those tags on your head, and then it should measures brain activities. And then cons, it's limited for structured tissues only, and it requires specialist interpretation. So you obviously you can't interpret by yourself. And then this one we have a tilt table test, and it evaluates fainting causes. So earlier we learned a lot of like types of syncope, and this is one of the tests that can help us identify which specific causes. So yeah, it helps diagnose vasovagal syncope uh, and control environment. Um, and then pro con is that it can induce fainting. It's pretty uncomfortable and it's like takes a lot of time. And then we have orthostatic vitals. Orthostatic vitals are basically just measuring your blood pressure, your heart rate, and measuring changes in them. And then pro is that quick. You can do it by like at the bedside, and you don't really need like any extensive like major complex equipment. And a con is that it's like less specific and it may miss like some major issues. And then blood glucose test. This is also a common procedure. It's just basically check for your blood sugar. So for patients with like hypoglycemia, like uh, blood low blood sugar, then they'll test for this. And its pro is that it's really fast, and it's like good for like a test for altered mental status. And then cons, it only evaluates one cause and it may need like repeat testing. And then lastly, we have Dix-Hellpike maneuver. Dix-Hellpike maneuver, and it diagnosed BPPV, which is we go back, Kenny,
Oh,
if you go back
yeah.
to yeah, another one. Yeah, BPPV, benign paroxysmal positional vertigo. That's one of it. That test specifically tests for this conditions. Yeah, and go back to.
All right, and moving on to our treatments. So first up, we have triptans. So triptans treat migraines via vasoconstriction, and they're highly effective for acute migraines, and it's very fast relief. It's not safe in patients though with heart diseases like cardiovascular diseases, very high blood pressure, or strokes, because it might cause chest tightness, and they're also very expensive. Uh, Antiemetics reduce nausea and vomiting. They improve comfort and help with hydration, but the downsides are they cause drowsiness or possible extrapyramidal side effects. So this affects your motor systems. It causes like involuntary motor disorders. IV fluids helps restore hydration in patients. So pros is that rapid symptom improvement, and it really helps in aiding in dehydration. Causes a risk of overloading the patients with fluids and also requires an IV access to the patient's vein. Vestibular rehab improves balance function. And pros is it's a long-term improvement and it's non-invasive, but it also requires the patient's compliance with the program and has slower results. The Epley maneuver repositions inner ear crystals, so it's immediate relief for BPPV, and it also requires no other meds. But it also might cause temporary dizziness during maneuver, and you may have to repeat it several times. Glucose administrations, basically you give the patient glucose, oral glucose, and this raises their blood sugar. So this rapidly reverses like some of their symptoms. It could be life-saving, especially in like a hypoglycemic attack. But this is a temporary fix, and you must treat the underlying cause. Beta blockers help prevent migraines, and it also reduces the frequency and the severity of them, and they're very commonly used, but they might also cause fatigue, dizziness, or worsen patients' asthma if they have that. Meclizine treats vertigo symptoms, and it reduces dizziness, like what vertigo is. Very easy to use, but it might also sedate the patient and it doesn't really treat the root cause.
Okay, and then lastly, we have our red flag symptoms section. These are common, like very symptoms that can help you decide and recognize what conditions. So first, we have sudden worst headache of sudden you have a sudden worst headache of your life. And then, why is it dangerous? It could signify a possible brain bleed, also known as a subarachnoid hemorrhage. Yeah. And then we have a headache with neck stiffness. So headache with neck stiffness could suggest meningitis. And if you guys remember last week, we learned about this conditions that, and one of the key symptoms of meningitis is the neck stiffness. And then we have loss of consciousness. This is serious and because it could mean a brain or cardiac emergency. And then we have persistent vomiting. So for a long, you kept vomiting for a long time, and it could mean increased intracranial pressure. So like the pressure beneath like the skull. And then we have new headache in older adult. So like you just start having a like headache and you would have never had a history of headaches before. So we have it could means possible malignancy, which means like brain tumor or like when cell cancer mass so that could leads to new headache or arteritis, which is when inflammations of the arteries around like your brain area. Yeah. And then yeah, basically these two, like the cell tumors, the cell mass, or inflamed arteries can just leads to like pressure, and then that leads to like a headache. And then we have dizziness with chest pain. Uh, and of course it could mean like leads to a cardiac cause, such as an myocardial infarction, which also known as a heart attack, or arrhythmia, or abnormal rhythms in your heart rate. And then we have fainting during exercise, and it could mean a dangerous heart condition. Now we have unequal pupils. This is serious, and it could mean brain herniation or stroke. Um, yeah, and then we have difficulty speaking, and it's one of the major sign of a stroke. And then we have inability to walk, which could mean cerebellar stroke, which we learned earlier. And then we have persistent confusion, which could mean brain dysfunction or hypoxia, so lack of oxygen. And then we have vision loss, and it could mean stroke or temporal arteritis. So maybe the arteries around your temporal areas is like inflamed. Yeah.
Oh yeah, just really quick, the sudden worst headache of life is also referred to as a thunderclap headache for subarachnoid hemorrhage.
Okay, so before we go into a breakout room, once again, sorry, it should be week 6. Yeah, week 6 handouts. And then you should have 4 tabs. and it's vocab list, the interview guide, your case report template, and the empathetic phrases, which we encourage you to use. After like a patient responds to you, try to use those empathetic phrases. And again, I meant week 6 handouts. So please have that ready. And then, yeah, we can go into breakout room.